I got so excited about Drew's Sandell status that I forgot to say who the discussant is, Judy Dougherty of Prudential. Thanks, Judy.
Good morning. Thank you, Alicia, for the opportunity to weigh in on a topic so near and dear to my heart. I'm happy to discuss Drew's research on the impact of financial education on retirement savings rates for women. In our work at Prudential, we've also explored aspects of the retirement income gender gap. And so I read this paper really with keen interest and enthusiasm, as did my colleagues, Georgia Kingsley and Jim Mahaney, who are here today and spearhead our research efforts in this area. Yep, there we go. This research is critically important for a lot of the reasons that Drew pointed out, because women do indeed have greater challenges in achieving a secure retirement. Research shows that women on average are lagging their male counterparts in their quest to achieve retirement security due to a number of factors, which we're all familiar with. Longer life expectancies, greater likelihood of being single at some point in retirement, time constraints due to their role as workers, both paid and unpaid, and as caretakers. Women spend twice the amount of time on household chores as their male counterparts. And of the 1 in 6 workers who also serves as a caretaker at home, 2/3 of them are women, and that's above and beyond their role as parents. All that tends to put retirement planning on the back burner. Women are carrying more debt. Drew alluded to this in the context of student loan debt, carrying more debt both early and later in their careers than prior generations, and we really think the issue of student debt among millennial women is really something to watch. More women than men are graduating from college. They're borrowing higher amounts, and they're struggling more to pay that debt back. It's estimated that women owe about 2/3 of the outstanding student loan debt, and they're going to earn less, so double whammy. We know that the average working woman earns about 79 cents on the dollar compared to her male counterpart. So you take lower earnings, you take a higher likelihood of going in and out of the workforce. That leads to a gap in Social Security benefits. Women's benefits are about over 20% less than men's on average. Women tend to have lower retirement plan account balances. Our own research would indicate that as much as 1/3 lower as male workers. And you add all that up, and there's the retirement income gender gap. The median annual income for women age 65 and over is over 40% lower than that of men. Many women recognize that they'll face a retirement income shortfall and are more likely than men to expect to work beyond the average age of retirement. In a recent survey that we did of pre-retirees, 25% of women said they didn't think they'd ever be able to retire, compared to 14% of men. Now, we know workers don't always have that choice, but that at least gives us insight into workers' thinking and expectations. So as if these challenges weren't enough, our own human nature, James was talking about some of this, often prevents us from acting in our own best interest when it comes to how we spend or save our money. Over the years, we've worked with experts in behavioral finance to shine a light on the challenges that impede financial planning. Challenges like trouble imagining a longer life, let alone planning for it, procrastination, optimism bias, impulse control, which we heard a little bit about earlier. Why our focus on these challenges? Well, as we've moved from a DB to a DC system, particularly in the private sector, the consequences of these challenges are much more severe because we've put the onus on the individual to enroll in the plan, to invest appropriately, to save adequately, and at the end of that, to convert all of that into a stream of income that hopefully they can't outlive. Work in this field, including by many in this room, has helped DC plan providers, plan sponsors, and policymakers understand these challenges, and it led to the advent of a more automated DC plan experience, so automatically enrolling people, automatically escalating their contributions over time, automatically defaulting them into appropriate investments. So understanding these challenges actually helps to inform plan design. It also helps to inform education. And that's where research like Drew's comes in. So a few thoughts on Drew's research on the effects of the Empower program in Wisconsin. This research produced very robust results. The sample size was large, the method of extracting data ensured accuracy, and the presence of several control groups made for meaningful comparisons. It gave us insight into several key features of education programs, and this is something as a provider of retirement and group benefits to employers, we're keenly focused on what aspects of education programs work. So aspects of the Empower program included multimedia outreach, so we could see what appeals to a broad variety of employee preferences. It had sort of a drip methodology, sort of a steady drumbeat of information in sort of small, bite-sized, easy-to-absorb components. It had peer-to-peer conversation, which I found a really interesting aspect of this program, and it would be great to learn more about what was done along those lines, because research does show that women tend to make decisions differently than men do. And we've also found in our work on engagement with workplace financial wellness programs that having, quote-unquote, boots on the ground to complement digital or online education and engagement is key. And it sounds like this program recognized the importance of sort of personal engagement as well. We found the results very encouraging in a number of ways. First and foremost, the conclusion that financial education could lead to higher participation levels for women was terrific and goes a long way toward improving women's retirement security. The receptivity of employees also, I think, highlights that the workplace is so conducive to education programs. Our own research bears this out as well. That employees generally view their employers as the longstanding providers of retirement programs and employee benefits as trusted partners who can help. My own 2 cents is once women get home, all bets are off. So the workplace is where they have really 5 minutes to sit quietly and think about these things and take in some of this education and take action to help improve outcomes. It was also encouraging because we know relative to some other levers that employers have at their disposal, education is a relatively low-cost way to help improve outcomes. It's within reach of just about every employer. They can often look to their benefits provider to provide education programs at little or no cost. So in terms of a few suggestions for ways we might think about extending this research, it's really interesting to think about why participation rates improved, but contribution rates did not. It could be sort of the content of the programming itself. But it's really interesting to extend this to the private sector, data availability aside, because we know in the private sector there could be an even greater need, given that there's generally lower retirement plan coverage, fewer pensions, less job stability. It would be interesting to, I think there was some ability to drill down into this by age, marital status. I was talking to Drew earlier and understand that the data might not support it, but it would be really interesting to understand differences by income or education level. If employers have those kind of insights, it really helps them with how to shape and calibrate the content of the education. And as Drew and Michael mentioned in their research, interesting to explore how other household finances might be affected as well. Education programs are just one of many arrows that employers have in their quiver to drive better retirement outcomes. Other levers include DC plan design, investment selection, the structure of the matching contribution, the availability of in-plan income options, data analytics, using employee census data that employers have at their disposal, along with benefits coverage information to better understand employee needs and gaps, to target education and solutions to the segments of their population that need it most, and to optimize the limited budget that they have to spend on employee benefits. Financial wellness programs. We've seen sort of just as over the years employers have really embraced the value of health wellness programs at the workforce, we're seeing them come along that same curve with the value of financial wellness programs. We think about financial wellness as helping employees manage their day-to-day finances, achieve important financial goals, protect against key financial risks. And hand in hand with that, employers can offer tools, calculators, other resources. We have an interesting statistic in a calculator that we make available to participants in the 401k plans we administer. It's a simple tool. It shows how, for a given amount that you invest, what that will translate to in terms of future retirement income. 1 in 5 people who uses that calculator immediately goes and increases their contribution to their 401k, and they do it by an astounding 5 percentage points of salary. So I know I'm running short on time here. Just want to point out that, we recognize that better financial security is a win for everybody. It's a win for employees, it's a win for employers, because there is a real cost benefit to employers when employees can retire on time. Happy to talk more about that. So in conclusion, the retirement income gender gap is real. Financial education can help reduce the gap, which is great news because it's a relatively low-cost way to improve outcomes. In addition to education, employers should include other levers like DC plan design and holistic financial wellness programs. I'd just like to thank Drew for this research on such an important topic. I really enjoyed reading it. It's so relevant to the work of practitioners and providers of financial wellness education in the workplace. Thanks.
Thank you, Judy.